Hello, everybody. Stephen Inghram here. So if you got a chance to look at my intro video, I mentioned in that video that I was going to offer a separate video on the differences between yoga and yoga therapy. And I think it's really important to do this to just kind of help you differentiate things in your mind, because our culture doesn't quite yet understand what the difference is between yoga and yoga therapy. And because I am in both of these roles as a yoga teacher and as a yoga therapist, I just feel that it's my duty to kind of distinguish these in your mind. So this is the purpose of me doing that. So I like to just to kind of set the context for this. I like to tell people that as a yoga therapist, I use the practices and principles of yoga for a specific therapeutic purpose and to achieve a specific therapeutic result. So just kind of keep that in mind as I go back and forth, as I compare and contrast the differences between yoga and yoga therapy. So generally in our Western culture, yoga is done in a group setting, which is exactly what we're doing with these live, LGBT-friendly Zoom classes. And so basically what that means is that any group of people, regardless of their medical conditions, regardless of any other um, determinants, these classes are going to be generalized to that group of people that shows up for the class. Now, that's in contrast to what happens in yoga therapy. Yoga therapy can occur privately, one-on-one with the therapist and the client, or it can occur in small group sessions. And in yoga therapy, this is highly individualized and whole person focused. So the difference is between a small group yoga therapy session and a group yoga class is that in yoga therapy, we actually group together individuals that are having similar experiences. So for example, a small group of people experiencing chronic low back pain, or for example, a small group of people that experience both anxiety and depression. Or another example of this might be a small group of LGBT individuals. So we group people together that have a similar shared experience. So now in our Western culture, yoga classes are primarily focused around physical movement, around what we call asana, the physical postures of yoga. However, in my yoga classes, that's not the case because I have all this additional training. But really the distinguishing difference in yoga therapy is that we use the entire totality of yoga practices. And you can kind of think of yoga as this umbrella that covers, that has this kind of vast expanse of self-care practices beneath it. And so that includes, certain mind practices to just help our mind stay more focused and concentrated and present. It also includes movement practices. It also includes breath practices. It also includes meditative practices. And these self-care practices, these tools of yoga, all facilitate reducing our suffering. And on the flip side, in yoga classes, students are actually dependent on the teacher to guide the class. However, in the context of yoga therapy, it's different because the focus is actually on the yoga therapist empowering the clients to engage with their health and well-being in a way that's going to help reduce their suffering and improve their health. Okay, so just a little bit about the training differences between a yoga teacher and a yoga therapist. So a yoga teacher, generally speaking, has 200 to 500 hours of training. A yoga therapist can have anywhere between 800 and 3,000 hours of training, and that all depends on whether the yoga therapist attends simply a certification program or a degree program. So I have a Master's of Science in Yoga Therapy from Maryland University of Integrative Health. which the first year was didactic, meaning I sat in lectures. The second year was a little bit didactic, but more clinically focused. And that's another difference between yoga teachers and yoga therapists. Yoga teachers have no clinical training, of course, unless they're nurses or physicians or physician assistants, unless they're actually in a clinical profession. But the yoga teaching profession in and of itself does not offer one any kind of clinical training. As I just said, as a yoga therapist, I received clinical training and I'm considered a practicing clinician. So also something to look out for when you are when you're looking for distinguishing, okay, is this person a yoga teacher or a yoga therapist? So yoga teachers often use the credential CYT, Certified Yoga Therapist, or RYT, Registered Yoga Therapist, and there's an organization that kind of registers yoga teachers. However, I personally use my yoga therapy credential, which is C-IAYT, which means that I'm certified by the International Association of Yoga Therapists. And I actually prefer to use that because I have a master's degree in that area. And I actually don't want to confuse people by using the CYT. So I strictly myself, just even though I am a yoga teacher and did undergo yoga teacher training, I strictly use my Master's of Science and my CIAYT to identify that I have those credentials. So the reason that I know this is maybe like a little overwhelming. I understand that. The reason I want to present this to you is because we here at Trans Etc. are at some point in the future, hopefully going to establish small group yoga therapy sessions. And so I just ask you to kind of stay tuned, stay up to date. We will be discussing more about this very soon and kind of launching this in the near future. But this video really is serving the purpose of just kind of setting you up for what is to come. So if you have any questions about this, if I confused you in any way, please reach out to me. I would love to talk to you about this. I would love to explain more to you about this. And again, if you have any questions, please reach out. All right, everybody. Peace.